Welcome to the Jeremiah Patterson Show, and thank you for joining me today. You might remember a couple weeks ago on the show that we talked about bird flu and the emerging risk it poses to animals. That was only a few weeks ago, and my goodness, has the crisis got even worse. This is now the current state of bird flu in the United States. According to the CDC per county, we have an epidemic effectively on our hands. It has become that serious, and this comes at a critical time. Last week on Valentine's Day, Wyoming reported its first case of bird flu in humans. The woman was hospitalized, but Wyoming officials do not believe it is a major event in the state right now. Then this week on Wednesday, this was the headline at the Travel. Minnesota declares a state of emergency amid a trifecta of viral outbreaks. What? Yes, there are three virological outbreaks in the state of Minnesota right now. Bird flu, HPAI, and AMPV have all devastated impacts on the wild birds and poultry populations throughout the state. Reportedly, Minnesota is the first state to declare a state of emergency for all three avian flus. In Ohio, right now, two counties this week declared an emergency over bird flu. The director of the state's agricultural department said, quote, "It doesn't matter if it's a small flock or a larger flock, they're susceptible. We are not the first state to go through this, but unfortunately, right now, we have the largest outbreak." On Thursday, bird flu was confirmed in rats for the first time in California. Also, 74% of California's dairy herds are now infected with bird flu. Essentially, the five more cases were confirmed this week, so that rose that up to 732 confirmed cases writ large. What that means now is 74% of California's dairy herds, meaning cows, are now infected with bird flu in the state. This comes as farmers are growing increasingly concerned as the prices of eggs are rising due to the infectious disease. A molecular biology professor at Johns Hopkins University told BBC News, quote, "Scientists have seen a number of warning signs in recent months that the avian flu is adapting to infect humans." According to a newly published study by the CDC this week, bird flu can now be spread from people to cats and vice versa. Scientists and infectious disease experts are worried that we are only a few mutations away from bird flu becoming a pandemic. And hearing something like that is horrifying considering who's in the office, who's in the Oval Office, and what he's doing to eviscerate the federal government right now, but more specifically, the health agencies in our federal government. I mean, it was just last week that this was the headline at France 24. Trump administration fires CDC disease detectives as bird flu fears rise. Nearly half of an elite U.S. epidemiology program known as the disease detectives were dismissed, dealing a blow to public health. So that was last week on Friday. Then this week, this is what we get. Because once they realized how essential those people were, they decided to spare them from the mass firings of federal workers. Oh, wait, we have to keep those people. Of course, that prompted this headline to be published in Stat News. Do you know how much of a major public health catastrophe you need to have Stat News write an article like this? This is an opinion piece from Dennis Hash, who used to be one of those CDC detectives, essentially sounding the alarm here about what's happening to the evisceration of public health agencies in the United States. Here, quote, "Over the weekend, the Trump administration appeared to reverse plans for devastating cuts to the Centers for Disease Control and Prevention's Epidemic Intelligence Service, EIS. It was the right decision. As a former EIS officer, I believe the mere proposition of dismantling such a pivotal program underscores a troubling reality. Our nation's already tenuous public health infrastructure and response capacity are alarmingly susceptible to political whims and are at risk of being indiscriminately cut. For more than 7 decades, the EIS program has been a cornerstone of the CDC's ability to investigate and control disease outbreaks. Founded in 1951 to respond to concerns about biological warfare, EIS has since trained thousands of epidemiologists who have played critical roles in addressing some of the most significant public health threats of our time. From the eradication of smallpox to the response to Ebola, COVID 19, and countless other outbreaks, EIS officers have been on the front lines, often putting their own safety at risk to protect the public. What is happening at the CDC, NIH, FDA, and other US agencies with public health missions should not go unnoticed. Public health officials, policymakers, and the public at large should recognize what is at stake. It represents not only a setback for public health today, but a failure to protect future generations from the threat we cannot yet see. To ensure the continued safety and well-being of our nation, we must remain vocal and proactive in defending the integrity of our public health agencies and systems. End quote. The Trump administration's woeful incompetence here does not just stop with what they did, what they tried to do at the CDC in terms of getting rid of the EIS program and eliminating those disease detectives. Because this week, they fired the scientists at the Department of Agriculture who were assigned to bird flu, who were assigned to investigating the bird flu epidemic. Right, like that's a great idea, but oops, you said how many birds are dying? How many birds are getting infected by this thing? Oh, this may become a pandemic. Oh, okay. We need those people. Hey, Johnny, I know we fired you this week. You know, it's something weird glitch in the system. I know we fired you because we thought your job didn't matter in terms of like working at USDA on bird flu, but then we just figured out that bird flu is a thing and it's actually really serious and bad right now. Do you think you could come back into the office on Monday? Do you want your job back? The old desk? The incompetence and ineptness of this administration is not shocking. It's an unmitigated disaster. It is a catastrophe. It is horrific. It's a display of stupidness and evil. How do you fire scientists at USDA for investigating bird flu and then not realize that the scientists that you fired at USDA for investigating bird flu are actually valuable? They are valuable. And you realize that only after you fired them, and what they are investigating is actually something of major public health interest. Because it's huge right now. And now you're looking to go find them, to rehire them and bring them back. Everything that this administration is doing has turned out to be catastrophic. Every single thing. They're trying to delete the government. They're trying to eviscerate the federal government. We talked about that a couple of weeks ago here on the Jeremiah Patterson Show on a democracy special. We're going to be having more of that, including later tonight. But in their campaign to eviscerate the federal government and to install a dictatorship and an oligarchy here, they are failing tremendously. And it's so sloppy, and they have consistent screw ups. This was the Secretary of Agriculture essentially inviting the fact that Doge is coming into her agency here. Quote, I welcome Doge's efforts at USDA because we know that its work makes us better, stronger, faster, and more efficient. I will expect full access and transparency to Doge in the days and weeks to come. End quote. Really? Really, Secretary Rollins? Because granting Doge access to everything means infiltrating your systems and monitoring reports, including potentially stifling or suppressing the severity of bird flu. Because if they've already fired the disease detectives at CDC and it's like, oh crap, we need you guys to come back. And then they already fired the USDA scientists at your agency, which you had to oversee and approve. And now you need the guys back. It begs the question here of the suppression of public health information in the United States. And that's not a wild suppression. That's not a wild assumption. They literally did stop all public health reports and communication with the public for a while when Donald Trump took office. They have stopped that. Now they brought it back. And we also have withdrawal from the World Health Organization. There is a major reason to be concerned. There is a major cause for concern when you start getting published articles and stat news about what's going on here in the United States. When you start getting reports from foreign outlets in France, about public health officials being fired in this country and it making no sense, it being completely inexplicable. There is a 5 alarm fire here that's happening right now. And there was some good news this week. There was some good news on bird flu this week. But I'm going to say this once again with cautious optimism. A vaccine for bird flu to be used in chickens gained a conditional approval from USDA, the same agency that just fired and shuttered its bird flu scientists and now is bringing them back. And I say that's temporary good news only for 2 reasons. One being that this article was recently published by The Guardian. The bird flu is now endemic in cows, meaning that it's now developed a permanent, constant presence around cows. Something that may be concerning, something that may be extremely detrimental when it comes to cows being vaccinated for bird flu and then becoming essentially resistant to it. So it being endemic in cows right now. And according to an infectious disease physician, because we do not yet have a handle on the virus, and it includes meticulous medical research and serious analysis, that the Trump administration is actively firing, then, oh crap, we need you guys to come back. We are going to have a hell of a lot harder chance of fighting this and avoiding a much larger public health crisis. This is the second reason we are cautiously optimistic. We should be cautiously optimistic about that good news there on the bird flu vaccine. Robert F. Kennedy Jr. was recently confirmed as the Secretary of Health and Human Services this week. A known anti-vaxxer, someone who has spread a wide range of medical misinformation, someone who is not and should not be the Secretary of Health and Human Services, really because he is not a medical professional. Of course, we had Dr. Irwin Redlener here on the show a couple of weeks ago to talk about Bobby Kennedy, as well as Mehmet Oz, as well as bird flu in the country, among other things. You should go back and watch that interview. But one of the reasons I say that I'm cautiously optimistic here about bird flu is because of Robert F. Kennedy Jr. now being the Secretary of Health and Human Services, and one of the first things that he just did. These are some clips of RFK Jr., and this is why you should also be cautiously optimistic about this news. Watch, and we're going to talk about it on the other side.
COVID vaccine, successful in saving millions of lives?
I don't know. We don't have a good surveillance system, unfortunately.
We don't know?
I don't think anybody can say that. If you show me science that says that.
You know, Bob, you say if I show you, you're applying for the job. I mean, clearly, you should know this. And that is, the scientific community has established that COVID vaccines save millions of lives, and you're casting doubt. That is really problematic.
That guy is now the Secretary of Health and Human Services, the Chief Public Health Officer in the United States, which, by the way, should I mention, oversees the CDC. According to Scientific American, quote, public health experts have expressed concerns about how Kennedy may shape the response to bird flu should the situation in humans worsen. He has publicly promoted drinking raw milk, which can carry live viruses, even though pasteurization has been proven to inactivate it. And he has suggested that the candidate vaccines to protect against bird flu may not be safe or effective because of the natural limitations or data for any vaccine that has not yet faced down its target virus in the general population. And they wrote another really terrifying article if bird flu becomes a pandemic and how we're not really ready for it, especially given Kennedy's recent horrific confirmation as the Secretary of Health and Human Services. Here, quote, right after President Donald Trump took office, amid the flurry of executive orders and agency upheavals, The administration told the Centers for Disease Control and Prevention not to release any reports or communication until one of Trump's people could take a look at them. Among the many reports not released that week was a study on how veterinarians had gotten bird flu. On the surface, this may seem like a small thing compared to the drama unfolding over tariffs, immigration, the firings of inspector generals, and whatever new egregious things Elon Musk is doing without congressional approval. But this report matters. The bird flu virus has been on the warpath since 2022, infecting chickens, cows, wild birds, and now pigs, ducks, cats, and several other animals. The virus is versatile, the virus is mutating, and it is surely infecting more people than we think. Surely the risk of a human epidemic is still considered low. Widespread human to human disease hasn't been proven, but viruses are masters of adaptation. A strain of bird flu that has made people really sick has now been found in cows. We are one fateful mutation away from yet another infectious disease that runs riot among people, and our country has just re-elected a president who doesn't just discount public health, but actively thwarts it. Robert F. Kennedy Jr., who would run our biggest healthcare agency, has not publicly walked back his anti-vaccine sentiments. The doctors who would run the Food and Drug Administration and the National Institutes of Health both decried common sense infection control during COVID. Our agriculture and food safety systems are riddled with loopholes that have allowed this virus to spread. We've seen this movie before. Millions of people have died in the COVID pandemic that began under Trump's watch. The Biden administration missed key opportunities to stop bird flu's spread. As a nation, we still have not yet recovered from the physical, mental, and social toll of COVID. What will happen if bird flu starts coursing through us? History gives us reason for pessimism. The Trump administration and red state officials had no problem downplaying the number of people who had COVID. If H5N1, meaning bird flu, becomes more transmissible, we will do the same again. End quotes. I will just note here that what we're talking about here in regard to bird flu, Scientific American has incredible reporting on bird flu that they update weekly on their website. Be sure to sign up and subscribe to their newsletter and read their work. They are doing just invaluable work, invaluable reporting over there. Right now in Kansas, still has the worst tuberculosis outbreak in the United States since the CDC first started investigating this disease. In Texas and New Mexico, measles has grown to become the largest outbreak in over 30 years, as there are now 90 cases in West Texas across 7 towns. The State Department of Health reports that 16 people are hospitalized right now. New Mexico has 9 cases. The vast majority of the cases in Texas are among people younger than 18. 26 cases in kids younger than 4, and 51 cases in children from 5 to 17 years old. In New Mexico, the outbreak started in an elementary school, grocery store, a church, hospital, and a Walgreens. This is an audio interview from a local doctor in Gaines County, Texas. He did this interview with Texas Standard on the measles outbreak at his hospital.
Measles is highly contagious and preventable. So how did this happen? Gaines County, the epicenter of the outbreak, had the highest unvaccinated rate in the state this school year at 18%. That's according to state health data. Texas allows for an exemption from immunizations for reasons of conscience, including a religious belief. And a look at school districts across the state shows some of those with the highest rates of unvaccinated students are at religious schools. Gaines County is also home to a large, close-knit Mennonite population, which typically shuns vaccinations. For more about what's happening in Gaines County, we're joined by Albert Pilkington, CEO of the Seminole Hospital District in the heart of Gaines County. Mr. Pilkington, thank you for joining us.
Well, thank you for having me on your show. I appreciate it.
Well, how does a rural hospital like yours prepare for such a rapidly growing outbreak?
Well, we got a little practice with COVID. We got a little practice with COVID. It's not as big of a deal as what, somebody from the outside of healthcare might think. I mean, we've been doing disaster preparedness and dealing with all kinds of, chaotic events since the beginning of, I guess, organized healthcare. And so it's not as tough for us as really, we instituted our protection protocols for our employees and to cut down the cross-examination probably within about 12 hours when we realized we're starting to have a trend of cases.
Well, let's talk about the patients. How are these cases being treated? I mean, this is very contagious.
Very contagious. I think that it's the one of the most contagious diseases that's out there. Fortunately, it has fairly low lethal component to it, but it's quite contagious, and so you really have to follow the same protection protocols as you would with COVID. Contact precautions, mask, and so that's kind of the big issue for it as well as for it being able to get with it. It's very contagious, and we've got a population that lives fairly close to us. A religious community, Mennonites, that they don't believe in putting anything foreign into their body, and so that falls within the avenue of vaccines. And so, once the disease process starts with one person, then it kind of, I'd say it's like a fire on a bunch of dry hay. It kind of burns through pretty quick, So
So tell me about what you've seen at your hospital.
youth, I mean, primarily youth. We've shipped, I think, about 3 or 4 patients out that were really young, spiking a high temperature. So we went ahead to be cautious and sent them up to Children's Hospital in Lubbock. And then we've had about 13 hospitalizations ourselves and stuff. And it's the same. It's basically you're trying to keep them hydrated, keep their fevers down and stuff like that. That's really about all you've kind of done. But it's just, I mean, it's not a terribly lethal disease. I mean, there are cases, but, relative to the amount of people that, used to get measles and how many would pass away, it's not like a swine flu or anything like that. So, I mean, we respect everyone's right to vaccinate or not get vaccinated. I mean, I think that's what it means to be an American, right? And so, what we stand ready to do is do everything we can to, help them get through the process, just like we help people get through the process before we had a vaccine.
There are an amalgamation of public health crises happening all over the nation right now. From bird flu to tuberculosis to measles, and recently listeria at a nursing home. And it is in a time like this where the Trump administration believes it's a great idea to fire the USDA scientists working on bird flu, get rid of the CDC disease detectives, fire 10% of the National Science Foundation, and for RFK Jr. to say, hey, you know what? That CDC flu vaccine campaign that we had, let's end that. Let's end the CDC's long-standing flu vaccine campaign, because why not? I'm anti-vaccine. I just got confirmed as the Secretary of Health and Human Services. What they are actively trying to doing is not just eviscerate the federal government, but in that effort, it also is to burn effectively the public health information system in this country, to burn it to the ground. Let's stop cancer research at NIH because none of this matters. Let's end all of that. What they're actively doing is getting rid of the key public health agencies in this country who inform the American public. The FDA was founded back in 1906. Why? Because there's lots of problems with food in this country, historically speaking. There was problems with the way that food was managed, the way that food was packaged, the way that food was distributed in the United States. The CDC was founded because of a malaria outbreak during World War II. It was then founded to address major infectious disease crisis in this country, which it has solved and mastered over its incredible run as a health organization, becoming the world's premier health organization for information on all things health. They're not just eviscerating the federal government, but what we should also be paying attention to is what they're doing to our public health agencies. While they are eviscerating the federal government, why Elon Musk is doing what he's doing. Yes, that's happening, but also be clear-eyed. Pay attention to what else is happening. I mean, this is why it's important. Do not just concentrate your attention on the one thing that they're doing. Also, watch what else that they are doing that's not getting more public attention. And that's why we're bringing notice to this. They want you to be focused on Elon Musk. They want you to be focused on Trump's executive orders. But what's happening at USDA? What's happening at the CDC? Who's silencing officials at the FDA? We are facing a situation in this country where there are multiple public health outbreaks, from measles to bird flu to tuberculosis and listeria. And it is a situation that quite literally no one is talking about in the mainstream press on a bigger level, or devoting much more attention to that should be getting. We here at the Jeremiah Patterson Show are going to continue to do this because this is a major public health crisis that is spreading large and wide. And it's not getting a lot of attention. But it should absolutely be on everyone's radar. As these two men, and now others, are going to effectively work together to destroy and decapitate the United States federal health hierarchy. And that is something that should terrify everyone.